Hello friends, I am Dr. Aksa Kayyum, FCPS gynecologist. Let's discuss procedures for cervical intraepithelial neoplasia. What is cervical intraepithelial neoplasia? It is pre-malignant lesion of the cervix with intact basement membrane. It has three categories: CIN1, CIN2, and CIN3. CIN1 is low-grade mild dysplasias involving in the lower one-third of the epithelium. CIN2 is moderate dysplasia involving greater than one-third to two-third thickness of the epithelium. CIN3 is severe dysplasia involving greater than two-third to full thickness of the epithelium. CIN1 is also called as low-grade squamous intraepithelial lesion, and CIN2 and 3 is also categorized as high-grade squamous intraepithelial lesion. So CIN1 mostly regresses and in the 80% of the cases, and the progress to the cancer is less than 1%. CIN2 regresses in the 60% of the cases and progress to the CA in 5% of the cases. And CIN3 regresses in 30% of the cases and progress to the CA in 20%. So what are the procedures? Procedure is the cryotherapy. Cryotherapy is the OPD procedure. It is cheap, easy, and has low morbidity. Technique used is here in the cryotherapy is double freeze and thaw freeze technique is used, and the gas is used as nitrous oxide. Depth of the destruction is 5 mm. It can be used on the ectocervix near the transformation zone, but if the lesion is far away from the transformation zone, then we use laser ablation. What is the complication? Most common complication of the cryotherapy is copious watery discharge. Next are the excision procedures that are LEEP, LETS, and conization. These are used for the management of CIN2 and CIN3. So LEEP stands for loop electrosurgical excision procedure, and LETS is large loop excision of the transformation zone. These are also OPD procedure. In this, there is less chance of bleeding, less chance of cervical stenosis or cervical incompetence. They are both diagnostic and therapeutic. Next procedure is conization. Cold knife conization involves entire area of the cervix is cut and removed. It is done in the operation theater. It requires anesthesia. What are the indications of the conization? When the colposcopy is unsatisfactory, when there is discrepancy between the pap smear, colposcopy, and histopath report, when there is high-grade CIN with positive endocervical curettage, when there is suspicion of microinvasion in the leaf, and there is involvement of the atypical glandular cells on the pap smear. What are the complications of conization? There is increased chance of bleeding and increased chance of cervical incompetence and cervical stenosis. Patient who wishes fertility should conceive after 6 months of the procedure, as there is increased risk of preterm labor and late miscarriages, and consultant-led care during pregnancy. Thank you. If you like this video, do share and subscribe.